Good morning. Welcome. My name is Christy McCoy, and I am the legislative chair for the Minnesota School Social Work Association. And I'm also the president-elect for the School Social Work Association of America, and I've been a school social worker for the past 16 years. And we are super excited and extremely grateful to have the opportunity to meet with you, Lieutenant Governor. And we're really looking forward to having an opportunity today to share just some of our firsthand experiences in navigating some very significant crises that we have been dealing with the last couple of months, related not only to the COVID-19 pandemic, but also the impact of George Floyd's death on our communities as a whole. One of the things that I just wanted to note is that school social workers have been providing services to students and families for over 100 years and really have been a critical link between the school, the home, and the community. And what you have before you today are some incredible leaders in the field of school social work that are all part of the Minnesota School Social Workers Association. And our association has been around for over 50 years, and is part of our mission. And similar to what you've really dedicated your life to, is really promoting the well-being of our students and our families. And with that said, we do that to really ensure that every single student has equitable access to educational opportunities and resources and supports. And we have kind of a specialized skill set that we bring to the educational community. We know that there's a lot of adults in our school community that support our students, but what school social workers are able to bring to the table is really highly qualified skill sets in regards to being mental health professionals and practitioners in the school setting. So we work collaboratively with other related service providers, and that really is best practice in meeting the needs of our students. But we also work in collaboration and partnership with our school-linked mental health providers. And then, as you know, there are many families, due to their values and their belief systems, that when we look at mental health service delivery in our schools, it's also been really pertinent and important for us as school social workers to create partnerships with culturally responsive community providers and to bring those in to really support the needs of the whole child. So today we are just super grateful to have this opportunity to talk about how our services have become even more critical, now more so than ever, because of COVID and the recent incidents that have been impacting our community. So I'd love to have you have an opportunity to kind of share some opening remarks. And then what we will do is each of the individuals that are here today will introduce themselves and share a little bit about the successes as well as the challenges that we've been encountering during this time of crisis. So welcome. Thank you for being here.
Well, thanks so much for having me. And I just wanted to say you're getting the realist version of the Lieutenant Governor today, as I'm wearing a Duran Duran t-shirt and a zip and a quarter zip, and my hair's in a ponytail. So you're getting all the things right now. But I'm really grateful to be able to talk to you. And Christy, thank you for just the introduction, and also congratulations on your election, on being president-elect of your national association. That's very exciting. So thank you. I'm excited to just hear from all of you today about an issue, as Christy mentioned, that's very close to my heart, which is the overall just well-being of young people and our students in particular. Especially now, and I just have to tell you, Dick Swenson was my school social worker at Cedar Manor Intermediate Center, and is frankly one of the reasons why I exist, because I was I'm a survivor and a child witness, and he was deeply engaged and involved with my family, and I just know the worth of the work that you do every single day. So thank you for it. And especially now, as 2020 has just proven to be the year of all the things, and as we are wrestling with COVID-19 and the fact that this pandemic has laid bare what we already knew, which is there were deep inequities in our state, that this is just, shined a spotlight on those inequities, and combined with for our students who also watched the murder of George Floyd as the world watched, and are now, for many of our students, being re-traumatized by that experience. That is something that I know that you certainly are dealing with as we are seeing this, just the response change, and the consequences of underfunding our educational systems and support systems for students and their families are really coming to a head in this moment. So, I know that your worlds have also been upended as we're looking at distance learning. Our family's fortunate to be in a district that provided tablets for folks who needed them. We certainly did, and have provided that additional support. But that's not the case for every district, certainly. And we want to hear a little bit more about that on this call today. We're trying to get the ESSER funding out and meet many of those needs, but we know that schools were already underfunded. It's not going to be enough, but we are certainly doing what we can. And I am the mom of a now second grader, as she is getting ready for the new school year, and have tried to protect her from as much as we can at our dining room table as we're trying to, run state government, and she's hearing some of the conversations, and but that I know that you are helping so many families navigate through this moment right now, and just grateful for your work, and just look forward to hearing from folks directly. I know you've got some questions and some stories, and I'm here for them. So
Great.
let's get down to it.
All right, sounds good. Well, thank you again. I know it's not a surprise, as you know, what we have been going through has had a significant impact on the overall well-being of our students and our families. And what research has repeatedly shown is that when students are affected by trauma or poverty or mental health issues, it has a significant impact in their ability to access learning and to engage in their learning. And there's no doubt that as we re-enter the fall, whatever that's going to look like, every single person within our educational community is going to be impacted in some way, shape, or form as we are moving forward. But we also recognize that there are going to be others, whether we're talking about staff or students, who will be really struggling with the results of some of the pain and the suffering that they have experienced, whether that has been due to a loss of a loved one. And again, I just want to take a moment to share our sympathies, because we know that you lost your brother to the coronavirus, and how devastating that is to lose somebody that you love as a result of this. And so not only are we dealing with issues related to grief and loss, we also are dealing with the racialized trauma, increased anxiety, the impact of just the ongoing uncertainty. So this kind of prolonged exposure to stress and trauma is definitely weighing significantly on our students and families. And one of the things that I will share, so my school, and Shelley, you'll hear from a little bit later today, is on University, about a block east of Lexington. And by the grace of God, I don't know how our school was not impacted, but a lot of the buildings around us were in the riots that had followed after George Floyd's death. And the reality was that for a lot of our students, they live in the Midway area. They live in the north end of St. Paul. And when public transportation shut down and there was no access to be able to get food, I work with pregnant and parenting teen moms, and have been for the last 10 years. They didn't know how to get diapers for their children. They couldn't get formula. They couldn't get some of those basic needs. So when that happened, there were two significant roles that I had to play. One was just to hold space for my students and staff to process the pain, the confusion, the anxiety that everyone was feeling. I had to also, during that time, figure out how quickly I could get my students and families what they needed. And so I was able to solicit donations and get support from different community members. And because we weren't allowed back in the school, we had a staff member who stepped up, and she's storing diapers as we speak, and formula, so that we have them ongoing, because we also don't know what things are going to look like in September if we're going to be able to come back. So that's just like one example of how school social workers, we've had to really provide a continuum of services across the board, whether it was in response to the initial impact of going into quarantine with social isolation when COVID first started, to the impact of what has been happening in our communities. You're going to hear today from each of the presenters how school social workers have been providing the continuum of services to truly meet the needs of our students and families. So I'm going to turn it over to Liz, and she's going to share a little bit more about the increase in mental health needs that we've been seeing during this time.
Good morning. My name is Liz Kruger, and I work in the New London Spicer School District in rural Kanawha County. And due to the rural setting, there are limited resources for mental health services in a normal school year. For example, the nearest child psychiatrist is nearly an hour away. And so school social workers are the first in line to help, and sometimes the only help in a mental health crisis. And distance learning was no different. One of our areas of expertise, as Christy had said, is being the link between school and home and the community. And during distance learning, I was not only interacting with students, but contacted by parents and community members and teachers, all asking for help to navigate those emotions and frustrations that came with the pandemic. And then with distance learning, I found myself collecting and distributing more and more resources on how to take care of oneself emotionally as a caregiver, and then helping them understand how their child can calm down when they're angry, and how to practice together and working on those skills, and helping with just organizational and time management skills that those students didn't have because they weren't in that school building. But the most difficult part of my job during distance learning was definitely helping youth who wanted to die by suicide. In an average year, I see about 4 to 6 suicidal students who need immediate intervention. But in the 45 days of distance learning, I worked with 9 students who were suicidal and needed immediate intervention. Those conversations included doing a suicide risk assessment, making a safety plan, trying to keep those students engaged with me while I'm on the phone trying to find parents, while I'm navigating Zoom with them, and then getting those parents to understand what their role is going to be to try to help keep their child safe, and then what to do to navigate the systems. Crisis centers were full, hospitals weren't always able, to take adolescent patients. And then the teletherapy part, getting that set up was really difficult because, either the provider, because we're really rural and our internet is awful, didn't have the resources to do this yet, or the family's connection was so unstable that video chat just wasn't reliable. And that reliability piece was with the devices and the hotspots that our district provided. And so I ended up doing sessions with students, multiple times a week to try to offset some of that inability to access community resources. And so as you can kind of hear from that just little tidbit, COVID, along with distance learning, absolutely brought on increased needs for mental health services in schools, and I fear that with the economic struggles many districts face, that we won't have the support staff needed to help these students and families and to continue to provide that care. And so my question for you today is, what ideas or strategies are you proposing to increase or maintain funding for school-employed mental health providers like school social workers?
So Liz, thank you for that, and thank you for just the work that you do every day and helping families to just navigate this really uncertain time. I also wish that I could tell you that somehow being Lieutenant Governor means that I have more of the answers as to the uncertainty and when it will be all over and done. I don't. But we're trying to give folks as many tools as we can to respond. When I'll just be very candid and say, in many ways, it feels like we're on our own with a lack of response from the federal government, and so are just trying to get through. For this past session before COVID hit, the governor and I had proposed an additional $60 million for district to hire support personnel to do exactly what it is that you're talking about, because we know that our kiddos don't come in pieces, and that is really important to meet the need. This would have covered 750 positions statewide, a 19% increase in nurses, psychologists, social workers, counselors, and we will continue to advocate for that in the future. We are in now this position that frankly no one was expecting to be in a $2.5 billion deficit. However, I will say this, that it is also really important, for us to continue to center children and families as we're making budget decisions, and we'll continue to do so moving forward. One of the suggestions that I would just have is that the ESSER dollars, that is the additional coronavirus relief that's being directed towards districts, that this is also the opportunity. Of course, we are talking about technology and additional devices and hotspots, and all those things are important with regards to distance learning. But as all of you know, the social emotional needs also need to be met for students. And so we just encourage you as much as possible. We put that out there, that like these dollars can also be used to meet the mental health needs also of children and their families. And would encourage you to talk to your districts to say that this is clearly a need and has to be part of the overall picture. But continuing to tell these stories, and to tell these stories in particular to the legislature, is really important. They, while we can do the work with the ESSER funds and the CRF dollars, the Corona relief dollars, ultimately the legislature controls the purse strings, and these personal narratives are the thing that makes a difference. As a recovering legislator, I got lots of facts, figures, and statistics and data, which, I'm a policy nerd. So like I groove on that stuff. But the things that, really stuck with me, were those stories. And to hear that in your district, Liz, that you talk about between 6 to 8 students who, are potentially suicidal, like that's real, especially in a district of your size. Like that matters tremendously, and people need to hear those stories. So it's we're still working on it, and there may be, just being strategic with those ESSER dollars, I think, can make a big difference.
Absolutely.
Thank you so much.
Thank you. So one of the things that we had done with the Department of Education is that they conducted a survey in May of all related service providers. And one of the things that came out of that survey was the challenges. And school social workers had the most responses to that survey, but the challenges that we saw as the top 2 were the same for all related services. And it was really in regards to struggling to get students to be engaged through the distance learning and attendance issues. But it's important to recognize that there's a lot of different factors that are impacting that. I think the increased mental health needs definitely are a resounding factor in that. And Anne's going to talk a little bit about another factor that has been significant, and that's related to housing instability. So I will turn it to Anne.
Good morning. Thanks so much. So my name is Anne McInerney, and I'm the McKinney-Vento liaison for St. Paul Public Schools. And I know you already have a lot of background knowledge around housing and homelessness, so I'm not going to go into all the details other than to let you know that because of the lack of affordable housing, and because of the fact that there's not enough shelter for families and youth. There's a backlog, a wait list, and oftentimes not even access to shelters in a lot of our communities across Minnesota. And so then we have a lot of our students are having to double up, sometimes in unsafe situations. So like in a district like St. Paul, one of the larger districts, we identify around 2,000 students every year that are experiencing homelessness, and school social workers are really providing a lot of that assistance while families and youth are going through the systems, helping them get into shelter, helping them, find affordable housing, getting move-in kits so that they can start off in an apartment if they get one, with cleaning supplies and beds and all that. So social workers have always been involved with all of that. During COVID, it has been really helpful. So I wanted to thank you and the governor for the moratorium on evictions. It's been amazing because our families that are in rental situations have been able to stay there. Our fear is, of course, that once the moratorium is lifted, it's going to overburden an already burdened system of just too much wait list, not enough space, all of that stuff. We're expecting that our school social workers are going to have to step up and really help with, as they always do, but again, with a spike of when the moratorium is over, of working with families and youth on prevention and trying to make sure that they can catch up on their rent. And if they can't, help them find something else and figure out how we can really avoid, prevent homelessness. I'm worried about how that's all going to go. The other thing that, just like Christy was talking about, all of the other effects that homelessness has on students and families, mental health and trauma and safety and food and all of those things. These are all pieces that school social workers are walking with the families and trying to help them navigate both housing and homeless systems, as well as the education system, and providing support throughout both of those things. So that's just what I wanted to share about. And again, I wanted to acknowledge the fact that I know you already have a lot of background knowledge on it. But my question was around how are you addressing the issue related to affordable housing and need for emergency family and youth shelters?
For sure. So thank you, Anne, and thank you for your work. I am also worried about that in this moment. We were in a housing crisis before COVID hit, and I know that there are certainly families who are tremendously worried about this. We've been able to, because of some of the flexibility with the COVID relief fund dollars, have been able to secure not housing, but at least hotels for about 2,000 individuals and their families, which has been good. And organizations who serve families or youth are also eligible for this funding support. And through our interagency work with Kathy Tenbrook at the state, have been able to navigate that. But I'll say this. We absolutely need the legislature, and we will. Special sessions don't seem that special anymore because we have them like every year. But we have continued to advocate for the additional $100 million for housing assistance and $260 million in affordable housing construction and public housing preservation. That's really critical. It's the largest amount, frankly, that's ever been proposed by a governor's office, because this is how important this is to us. If the legislature just decides to pack up and go home again, we'll just try to move those dollars ourselves through the CRF funding for the housing assistance. We also had a conversation, the governor and I, along with Congressman Keith Ellison, I've lost all track of time recently, and to talk to folks also about individuals who can't pay their mortgage and what kind of relief we can work with banks to provide there. The rental housing piece is a lot trickier with landlords, but I know, Anne, you're in St. Paul. I think Mitra Jalali, Councilwoman Mitra Jalali, is doing a lot of really good work on tenants' rights, and that's also stuff I think that we need to continue to support at the local government level. But the big answer is if we can move this 100 million in the housing assistance, that working with all of you as social workers as well will be really important to make sure that families are connecting with that funding, and continuing to work with our philanthropic community to make sure that families who are undocumented are also getting the support that they need, because the federal government has put so many just strings on the larger funding coming into the state.
Thank you.
Christy, are you frozen?
I'm back now. Sorry.
Okay.
Okay. Oh, there you are. You're in two places.
There's two of you.
Oh my goodness. All of a sudden it just cut out on me. The joy of technology, of course. Well, I know you won't be surprised. You know, the other issue that has been resounding is food scarcity. And essentially, that was probably the most difficult challenge really early on, when people kind of panicked and they were taking all the supplies, right? And people couldn't find toilet paper, they couldn't find flour. And even though things are getting a little bit better and grocery stores have done an amazing job, food scarcity continues to be a challenge for our families. So I would like to turn it over to Molly and Sue, and they're going to talk a little bit about how we've been addressing that issue.
Hi, Peggy. I'm Molly Fox. I'm the lead school social worker for Mankato Area Public Schools, and I'm also the current president of the Minnesota School Social Work Association. And Sue, do you want to introduce?
Sure. I'm Susanna Schrader. I work for the Owatonna Public Schools and am the Minnesota School Social Work Association treasurer. Very nice to meet you and be on this call today.
Nice to meet you both as well. Thank you.
So some of the things that in the Mankato area public schools that we really had to work on when all this hit, kind of like Christy said, was navigating families and getting food from our local schools, which was very successful. I felt like the food service program really did a great job being able to set up access. And then also for families who could not get to maybe the schools to pick up meals, that then the bus companies were delivering to areas that maybe couldn't access buildings. Some of the other things, though, as time went on, is just being able to get basic needs and things like that, like Christy said, just like toilet paper and diapers and those kind of things. So as school social workers, that was kind of our charge as well, is making sure that people had what they needed to survive the basic needs at home. And the other thing is we work with the backpack food program, or Feeding Our Communities partners. And I know that there's other entities across the state that are similar. I know that their programming has doubled since COVID in our area. The students who have been signed up for that service. Also, just recently talking to the director of our program, our numbers in Mankato, we have 8,400 students. The registration has gone up by 100 in the last 30 days for summer feeding. So I guess one of the questions that I have, and Sue I know has some things to talk about too, but will there be ongoing support in funding for these extra programs, such as backpack food program and our food shelves, to continue to feed kids outside of the school hours?
So at least now the answer is yes. And we've been able to connect families across the state with additional access to SNAP benefits. I think in the amount of $18 million recently, that extra boost. And so, some of that depends on the willingness of the federal government to continue to take action. But we have stepped up pretty intentionally. We have a whole series of work groups as part of our COVID response, and food security has been one of those. And so connecting folks all across the state with food shelves, helping to to get orders done, working really intentionally with our tribal communities across the state as well. So this is something we're continuing to work on and we'll track, and I assume that we will do it, you know, at least through the end of the year as we're looking at COVID. There were some, I think, moments last month in particular where things got a little scary with the lack of availability, frankly. But I think we're seeing that rebound, and we're seeing food shelves be restocked and doing better. But also with the unrest around the murder of George Floyd and some of the protests, we know that continues to be an issue, especially for the communities who no longer have access to, as Christy, as you mentioned, to grocery stores or places around there. So we're partnering with folks there as well, but we'll continue to advocate with our congressional delegation for that additional support, and we'll be monitoring and moving things as best we can through the state.
Great, thank you so much. Sue?
I just want to highlight a couple things that I think went really well locally. The distribution of food through the school lunch program. We had a variety of sites in the community that buses took the meals out to students at those sites. Administrators, school personnel were on those buses, so it served, of course, the great service of providing the nutrition, but it also gave the face of the school still to those kids, and they got to see and know that we care about them, and we were present for them. So I think that was really positive. There was really good in our community collaboration between the two churches that that are linked to school, to us at school, and families that are in need of sustaining food. So we have the food shelf and two local churches. They all collaborated really well to make sure that we were reaching the families that we needed. And often school social workers were getting the food and delivering the food to those families who did not have transportation. And that continues through the summer. Wednesday's the day at noon. So I'm grateful for those resources. I think that some flexibility with the nutrition program through this time of COVID was essential. I haven't seen them be this flexible because of all the rules and regulations in food services, but they were this time around, and I'm grateful that we were able to do some collaboration where they're actually speaking to the community resources providing the food, and everybody's working it out together. So
thanks, Sue. You know, it won't be a surprise either to know that one of the reasons why students were being challenged in engaging in distance learning is oftentimes they had lack of access, because we were all at home, to really essential supports on their IEP. And so for many of our students, some thrived, some were kind of in between, and we had others that were really challenged to do learning in this particular format. So Dan's going to talk a little bit about kind of where things were when it came to providing resources and supports for our special education students, and the challenges that we need to consider moving forward.
Hi, thanks again. I'm Dan Porter. Thank you again for taking some time to talk with us today. I'm Dan with Minnesota School Social Work Association Professional Development Chair, and then I also work with the Northeast Metro 916, which is an intermediate school district that huge percentages of our kids are in special education setting, and oftentimes setting 4. I'll also divulge that I have 2 kids, both in special education, and one of them, as kind of Christy had mentioned, you know, my oldest actually did fantastic with the virtual learning, and I think it's because we run such a tight ship at home. He really couldn't get away with much, but he got higher grades than I've ever seen. So I'm appreciative of the virtual learning and opportunities that, you know, my school district, or where my kids go to, how they provided services. And so I do think that in some ways kids are thriving under under this kind of different opportunity. And I think this is only one way that we need to think about education moving forward, to really think about how else we can, you know, kind of think outside the box to support kids under different ways than what we've maybe been traditionally doing in terms of, you know, that brick and mortar kind of way we've had in the past. My other one though didn't do so great, and has been struggling with it, and he's going to move into second grade, and he has had more challenges that I think are more similar to the other setting 4 students that we're providing services for in Northeast Metro 916. And I want to just say that the social work support 916 is actually pretty highly staffed in social work services, and they are supporting, you know, kids not only doing one-to-one. Most of their special education services have mental health supports doing one-to-one, you know, like once a week, or are doing group kind of format. And then on top of that, they're doing just these other services that all my colleagues have already talked about in terms of supporting the day-to-day needs as well. You know, when you talk about special ed, we're also talking about really unique services and supports. And what I'm hearing from a lot of the families are that there's additional challenges that come into play when we talk about providing curriculum or instruction home to the special ed students, and then have an expectation that you know, that the parent would then be able to deliver those services without having, you know, the foundation or the training or understanding about how to support a special ed kid or student. Or so I think those are some of the, you know, the kind of the takeaways I, you know, just wanted to share in terms of what I think parents are saying or struggling with for kids in special ed. And then also there has been some positive things too. The other thing I just want to mention is that, you know, we've been really fortunate to have access to some co-located supports, you know, with the grants that have happened for co-located mental health supports in school districts. And I think that that's fantastic. The other thing to kind of know about that is that we're only able to, those professionals are only able to support the students where there's a signed release, where there's a lot of students obviously that are not having that signed release, and then school social workers are supporting those services. And then kind of the last thing I'll just mention is that there's a lot of federal funds being left on the table in terms of third-party billing. As Christy had mentioned, that there was a survey that went out with related services, and school social workers are almost zero to none doing any billing for services because of the way that the current system is set up. And there's a lot of federal funds being left on the table of services that school social workers are already providing and doing the work, but there's some alignment that needs to happen in terms of legislation so that we could start billing for services and then access those federal dollars that are being left on the table. So anyway, thank you so much again, Peggy, and for all of you to just be part of this. I really appreciate it.
Thank you so much, Dan. And I just want to just say, like, you know, that we know that closing schools during the pandemic was one of the hardest decisions that you know, we certainly had to make, and you know, one of the major challenges was absolutely the things that you mentioned, and making sure that our children in special education have the support and access that they need. We continue to learn more, but I am eager to get kids back to school, but also knowing that there are many of our students who have underlying conditions, and that we have to be more intentional there. We have other folks on this call from my team as well, who are, you know, listening to your suggestions and making sure that, you know, the third-party billing, I think, is also something for us to think about, and I really appreciate that. So we'll bring that back. I know that we're about 15 minutes over, and I apologize for getting started a little late, but I would encourage you to please put any additional comments or questions in in the comment section on Zoom, but I will just say a couple of things. I know that there are some additional questions that folks have that I can sort of answer briefly here, if that's okay. The technology funding, which we continue to hear about, it is the ESSER dollars, but it's also the GEAR funding, the Governor's Education Emergency Relief. We're also talking to some businesses across the state about their role in being a good sort of partner with districts and seeing if there's the ability to meet additional technology needs. And for both of these pots of money, we've continued to hear that the distance learning and the technology divide is a big piece of that. But just generally for all students, the magic of schools is that you're in community and that you're with other students and you're with your teachers and, social workers and janitor engineers, and that there's an entire community of people who care about these students. And, we are eager to figure out how to do that safely. There is an opportunity to come back for an additional $10 million in the special session for some of the technology support and broadband. But I think what this has just shown me, especially in greater Minnesota, that broadband, and we have to think about it as a utility and just get serious about the real need. I've talked to too many students, in particular in Marshall, who do their homework in their cars in the parking lot after the library is closed. And so, that this is clearly an issue. And then the last thing, there's I just want to name, I know we've got many more questions, but I just want to name one of the things to the question that we got from Shelley about what's the vision of the governor's office to address and dismantle systemic racism. I can tell you that we have had a real shift in our office where for a long time we talked about DEI, diversity, equity, and inclusion. And now we're in this moment where that's not enough. We have to truly be anti-racist and anti-racist in the policies that we're looking at, making sure that we are centering the people who are most impacted, but also realizing and just naming the fact that we work within a system that has been built on the foundation of literally the oppression, in particular of the Black community and the Native community, and that we are now having very intentional conversations in our office about what that means and what that looks like. But I'll be candid with you that, we had many members of the House of Representatives who expressed more concern about the removal of a statue of an individual who I personally know was, by his own admission, sold 9 and 10-year-old Indigenous girls into sex slavery and was responsible for the beginning of genocide in the Americas. And so there were members who talked more about their concern about that statue than about the murder of George Floyd and the need for reform and to undo these systems. And as an Indigenous woman who's Lieutenant Governor, I am the target of many of those comments, and it's a thing. And so I will just say to you, the governor and I stood firmly with the people of color and Indigenous caucus within the House and Senate, and our calls for police reform and accountability. We will continue to do so. And, I think when we think about our response to this, it's really about scaffolding. Mm-hmm. It's about, what is possible now, also looking in the executive branch, what can we do through agencies, grant funding, the requirements. A big dog organization with 3 grant writers is going to have a better opportunity than smaller organization where the grant writer is also the executive director, but they're able to deliver services in a way that meets the need better than this big dog organization. And so those are some of the things that we're looking at, but also looking to, continuing to do work in partnership with community to rebuild and not replace in Minneapolis and St. Paul due to the civil unrest, but also talk about into the fall and next session, which is a budget year, how do we truly look at the policies and the investments that we're making and start to, I think we are well positioned to also talk about racism as a public health crisis and name it as such. And so, you know, it's all changing. And I think, you know, the governor acknowledges his role as a white man with privilege, and his job is to create the space to make sure that the voices of people who are most impacted in the BiPOC community are the folks who are able to move the solutions. So undoing the systems in this state that have existed for 150 years is a tall order, but we are tasked to do as much as we can within the next, you know, 2.5 years or so, more if we're lucky, or maybe not. This has been a rough 18 months, but that you know, that this is something that we take very seriously, and we are clear about this opportunity. I had a conversation with Valerie Castile, with Philando's mom, just last week, and she said, Peggy, God gave you Philando and it wasn't enough. And then God gave you George and he needs to be enough. Mm-hmm. And so that is, for me, the call that I heard to action, and continuing to, as a light-skinned Native woman with privilege who's in these places and spaces, to use that to be able to make those connections, but also be willing to tell the truth about my own experience, and that, you know, I'm trying to figure this out too. And so I know that that is also the work that the young people and the families you are working with every day are dealing with. But my hope is that Minnesota Nice has been what has been killing us for generations, and that you know, we are moving beyond that and having the real conversations and just naming it. It is racism, racism, racism. It's and you know, that we will have your backs as you are having those conversations in your districts as well, acknowledging that for some it's riskier than others. And so, you know, to just be willing, especially to step up for the Black, Indigenous, and people of color in your district, especially if that is not you, to stand in that fray in partnership with the folks in your community. So with that, please send your additional questions or comments. I don't want this to be a one-off. I hope that we can continue to do this again. Again, I appreciate all of you, and just please know that I am the Lieutenant Governor because of Dick Swenson and because of school social workers, and that I just appreciate the work that you do every single day. So thank you so much, and we'll talk to you soon.
Thank you so much for your time today. It was a real honor. We appreciate it. And if you have a moment, can we take a real quick, like, still picture?
Oh, for sure.
Okay.
You got it. These are always awkward.
I know.
All right, is everybody feeling ready?
Oh yeah.
Okay, all right, here we go. Beautiful.
Awesome.
Thank you. Well, again, we appreciate the time, and if we can be a resource in any way, please let us know, and I will work with your team, and we definitely look forward to ongoing conversations with you down the road. So Great. Thank you again. Appreciate you.
Thank you so much. Take good care, everybody.
Have a great